If your hip hurts and you're over 50, then you may be worried that you have osteoarthritis in your hip. This video will help you to work out what's going on with your hip and whether you need to go and see a doctor. So, 3 simple tests. Number 1. The first test is the hip flexion test. So, flex your hip up by simply pulling your knee up towards your chest as far as you can go. When you do this, do you feel a stretch here in your glutes, or do you feel a squashing and pinching in your groin? If you feel a squashing in your groin, that indicates that it's the joint which is limiting the movement. If you feel a stretch in your glutes, that indicates quite simply that it's tight muscles. Try taking your knee out to the side and then seeing if you can go a little bit further. When you do that, you might feel less squash in your groin and more stretch in your glutes. Generally speaking, if you can bring your knee up towards your chest and you feel a stretch in your bum rather than a squashing in your groin, this indicates that your joint is in good health. And if you are experiencing hip pain, it's less likely to be from the joint and more likely to be from the muscles and tendons. So that's test number 1. Do you feel stretching or do you feel groin squashing? The second test is called the Fabers test. So from this same lying position, bring your knee up and cross your leg over your thigh on the opposite side. Then let your knee drop out to the side by simply relaxing your leg. This, as I said, is called the Fabers test. It's also called the 4 test because of the arrangement of your legs looks a bit like a number 4. See how far your knee can drop out to the side. If you have osteoarthritis of your hip, you're likely to have a tight and limited hip joint, in which case your knee won't go much further than 45 degrees. If you've got good joint health, your knee will drop out past 45 degrees and head down towards the floor. Now my hips aren't that flexible, but you can see that my thigh is almost parallel with the floor. A more flexible individual would probably be able to get their knee down to the floor quite easily. But even if you're up here at 45 degrees, it still indicates a reasonable level of joint health. So the reason you're doing this test is to look what your range of motion is like. If you have a sore hip, yet you're able to drop the knee out to 45 degrees or more, that indicates generally good hip joint health. If you're at 45 degrees or less, that does indicate a stiff joint. So the third test is more of a question than a test. With the pain that you're experiencing when you're walking, perhaps more so walking uphill or downhill, for example, is where is the pain? Where are you experiencing it? If you're experiencing it here at the front of the hip and in the groin, this indicates more likely a joint problem. However, if you're experiencing it out here towards the outside and the back lateral side of the hip, this is common and it actually indicates more of a muscle and tendon problem. So for the professionals watching, the condition that it's likely to be is gluteal tendinopathy, more historically known as trochanteric bursitis. And there's some simple exercises you can do to help reduce the symptoms from that condition. So if your hip pain continues, make sure you see a medical professional like your doctor or a physiotherapist, for example. If you're looking for some exercises to help with your hip pain, then I'll pop a video up on the screen here, which you may find helpful. And you'll also find lots of other helpful videos on our channel, which are contained in our hip treatment playlist as shown here. Thanks for watching. Please share this video with anybody who you think may find it helpful. We'll see you in the next video.